Hello, everybody. I'm Beatrice Credi. I'm from ELPA, and today I am with Professor Linda Wittkop, who is involved and is also she's also a principal investigator in the IPQB project. Professor Wittkop is a clinician epidemiologist and associated professor in public health and biostatistics at Inserm Unit 1401 and EUCLID FRRIN Clinical Trial Unit, where she's interested in clinical studies and trial design and in the analysis of clinical study results in the field of infectious diseases. She's also affiliated to Inserm Unit 1219 on statistics in system biology and translational medicine. She has outstanding scientific output in clinical studies for HIV and HIV-HCV co-infections. Her expertise and her team are a significant contribution to the clinical trial design, management, monitoring, and analysis of results in the clinical trial that is included in the IPQB project in Work Package 2, and her team will have a major contribution to the integrated analysis of biological and clinical data generated in experimental models and in the clinic during the proof of concept clinical trial. For this reason, she is the principal investigator, so the leader of the Work Package 6. Thanks for joining us today. So we mentioned a clinical trial and we mentioned the analysis of biological and clinical data generated during the whole project. But let's start little by little with the scope of the IPQB project before going into the detail.
So first of all, thank you very much for the kind introduction. And yeah, so I'm implicated in two not completely different, but different work packages with completely different aims. But okay, let's start first with what is the overall scope of the IPQB project, which is a very important project because we are aiming to develop novel cure strategies for hepatitis B with hopefully a finite duration of treatment, so that it's not a treatment for all the life, but finite short-term or longer-term duration, but that once you can stop being treated. And so basically we also aim with this to improve patient management and also the prevention of hepatitis B associated liver disease complications, because this is a very important point for you, because as you know, once you're chronically infected, then you also have higher risk for several complications you might prevent. And also to help treat more patients, because especially in highly endemic countries, very often people cannot afford lifelong therapies and also their monitoring. So it's very important also to have some innovative cure strategies to help treat the most of the patients we can reach.
So finding a cure, this is the main scope. But for finding a cure, of course, we need a clinical trial. That's why there is a clinical trial included in the project. You are a clinical epidemiologist and you are contributing to the trial design and the overall management of the trial. Can you tell us more about the clinical trial?
Yes, I can. So indeed, you're right. The clinical trial is one of the aspects which needs to be done if we would like to find a cure strategy, but it's not the only one, but we will hear about it later. And so regarding the clinical trial and the management, so my team and myself, we make sure that the clinical trial is implemented with the highest standards internationally to ensure that we have high quality data, because this is all about, I mean, if we set up a clinical trial, we want the data to be of very, very good quality so that we can answer the scientific questions which is asked. And so this means that we were involved in the study design, and also in all of the steps until public application of the results. So this includes a lot of different activities. So for example, we will make sure that the design of the study is correct to answer the scientific question. And then we will make sure that we have the right data collected. So setting up a specific case report form. We will also make sure that we monitor that the data is correctly collected. So we will have central monitoring. So we will do some queries to the centers to make sure that the data is completed as it should. And also we will send what is called clinical research associates. So these are people who are really highly expertised in looking at your data at the clinical side and to make sure that everything is correctly entered in the case report form. So this is really something very, very important. And then, by the way, we also do facilitate the management of the trial by organizing a lot of different committees, so such as, and preparing them, the scientific committee to give the scientific community involved in the trial all the information needed to make sure that they can follow it correctly. And also we will organize, for example, data safety monitoring board committees, which is also very important for you because they will make sure that there are no safety concerns. And for that, we also are going to organize them, but also to prepare all the data that needed together with the sponsor and the clinical investigators. And this is really a very important point as well, because we want to make sure that there's nothing that would put you on any risk during the clinical trial. And lastly, we also will make sure that the statistical analysis of all the data collected during the trial is analyzed in accordance with international recommendations, so that there would be no fail to answer again based on the hopefully highly qualitative data, the scientific question, because this also, we need to respect a certain methodology to be able to do it.
So you mentioned patients, of
yes.
course. And my question is, why is essential for patients to participate in clinical trial, and specifically in this clinical trial?
I think it's very important because they can help to make us advance in research, because clinical trials are important for discovering new treatments for diseases and as well as new ways to detect or diagnose. If you are not doing a specific clinical trial for treatments, there are others. And also, to reduce the chance of developing the disease or getting complications, as it would be for hepatitis B, for example. And so why is it important for patients? So they can take a more active role in their own health, I think, so by participating in a clinical trial. And so they also gain access to new treatments or innovative treatment strategies that are not generally available for the whole public. And in addition, I think clinical centers which are participating in clinical trials are in general very experts. So they give expert medical care, and so they are in general the leading healthcare facilities in the countries. And so I think, so basically, if patients engage in clinical trials, they also really make sure they're getting the best follow-up and care they can get. And last but not least, they will also help others by contributing to medical research. So so I think it's a lot of different aspects if you go for a participation in a clinical trial, but yeah, it's really taking your own half as a one of your main own roles to make sure that you get the best strategy care you can. And yeah, I think for me this would be the most important thing. And
you mentioned safety. You mentioned safety also in describing your tasks in the framework of the project, and you mentioned excellent medical center that are of course developing and putting in place the trial. However, we know also from a patient association perspective that sometimes patients are afraid of participating and of engaging in this process. So from your point of view, is there a strategy that, together you from the scientific field and us, together with patient association, some strategy with which we can lower the fear that patients sometimes experience in these regards?
Yeah, this is a very important question. I think the most important thing is, I think, to give patients a voice and to give them opportunity to express their fears, so that there should be some time for them to express it and to be listened, with all aspects regarding a clinical trial or research. And so basically there should be time on the association side, but also time on the researcher and clinician sides to listen to them. And another aspect, I think, where probably association can bridge the communication between researchers and patients is that there could be a kind of education. So, for example, giving researchers or clinicians the opportunity to explain what a clinical trial is in general, but also how they work, how they are set up, and why also it is important to respect a specific methodology, which is really indispensable to answer a scientific question. And so ALPA is already doing that. So also by interviewing us, but also there are some videos recorded also. For example, I gave a talk about clinical trial methodology, trying to be as understandable as possible. Sometimes it's difficult. And so there needs to be also time for interaction, I think, so that people and patients can ask their questions, because sometimes we may need to explain it by different words several times to make sure that everybody understands it fully. And I think that, so basically, listen, give time to express to patients to express their fears, and also for to assure them that their voices are heard. I think this is something very important.
Yeah, I share your perspective. And by the way, all the videos recorded together, ALPA and the scientists involved in IPQB are available on both website and on both social media channels. So it's very easy to listen to them and to share them. And so thank you for mentioning this activity that we are doing together. But let's get back to your involvement in the project. So we mentioned data, because your involvement revolves around mainly data. And we mentioned all the data that you can collect and that you are managing in the framework of the IPQB. But as we heard from your presentation, there is much more that you are doing with data. And this is about this integration of the immunological and virological data generated in the IPQB project in its whole. it's very probably not easy to understand that these two different levels. So let's hear about a bit more about this.
Yeah, I will try to disentangle that. So indeed, I already explained that there's some kind of data management linked to the clinical trial, where we make sure to collect the data needed for the clinical trial via specific case report forms and so on. And then, as you know, there's the IPQB project as a whole, but which is much larger than only the clinical trial. And so there's a lot of other data collected and generated by the whole consortium, either by biological data from humanized mice models, and there's also a lot of very specific data generated by blood samples which are taken during the clinical trial, but not only, but because there's also blood samples which have been collected in other studies of hepatitis B infected patients, and they will generate a lot of very specific data about cells, about immune responses, about very specific and difficult to understand virological parameters. And so basically the idea of one of the work packages is to bring all this data together. So make sure that they are firstly all in one space, so that they are accessible for the whole consortium in one space. And then an important aspect of this work package about data science and data integration is that we did not want to analyze all this data separately. But this will be done for sure as well, because there's some specific questions linked to specific data as well. But to really understand what's really going on from a physiological point of view, so what's going on in your body, and specifically in the liver environment, because it's a hepatitis B project, we would try to use specific models and techniques, which are either developed by the team I'm affiliated to, or by others, which are really cutting-edge statistical and machine learning methods to understand how the immune and virological response work in a patient. And ultimately, we would like to develop, based on all this different data generated by all the different people working in the consortium, a model which would allow us to predict the immune and virological response of a patient based on its characteristics. And this ultimately and optimally would allow us to define or help to define cure strategies for hepatitis B.
So it's like paving the street also for the future of research in hepatitis B.
Yeah, I think, in research, it's always a bit like this. We try to answer specific questions, but we also want to prepare for future and to advance things. And so in a way, indeed, the work package 6 will hopefully lead to give some insights and to generate hypotheses for future clinical trials or for future treatment strategies that could be used in hepatitis B, which still would need to be tested by a clinical trial. So we would generate hypotheses, but hopefully on a very, very high level, because we have very, very good data. And so could then inform a new, for example, clinical trial design for hepatitis B cure. Yes.
Fantastic. Thank you very much for your time and for your explanation. I wish you, everybody, a good day. Thank you very much.
Thank you very much for listening.